Okay, good morning class. So this is the video discussion for chapter 8 and we will be discussing in chapter 8 the nosocomial infections. Okay, when you say nosocomial infection, so include natin dito yung mga infections na nakukuha when we are admitted inside a hospital. Okay, so in the future, when you are finally a nurse, you will be working inside the hospital. So it is very important for you to understand that most of the diseases and most of the infections that you can get will be present inside the hospital. So there are proper protocols that must be followed, okay, when you are a nurse and you are working inside the hospital in order to not, okay, get nosocomial infections. Okay, so let us start. So here are the chapter outline. So this chapter is very short. It is only composed of at least 3 pages, no? So nosocomial infections, I think para mas makafocus kayo, hiniwalay siya because in other books actually included na yung ating nosocomial infections doon sa microorganisms and diseases. But in your course pack, hiniwalay siya, no? Because I think it is a very different approach in the infections compared doon sa naunang chapter. Okay? So factors in chapter 8, you will be including the factors causing your nosocomial infections, and then you will be also including how to control your nosocomial infections. Learning objectives, you must be able to discuss the factors and describe the ways of controlling the nosocomial infections. Okay, let's start. I hope this is recording. Yes, it is recording. So let's just see if the audio is okay. Okay, let's talk about nosocomial infections. So when you say nosocomial infection, this is an infection that develops during the course of a hospital stay. Okay? You are getting the infection while you are inside a hospital that was not present at the time the patient was admitted. So, pagpasok mo ng hospital, wala ka pang infection na ganito. And then after a few weeks inside or months after after being admitted inside the hospital, bigla kang nagkaroon ng another infection. So that is a nosocomial infection. Okay? So this type of infection actually does not show any evidence of being present during the admission, no, in the hospital. When you say admission in the hospital, so di ba na-admit ka? So unang pasok mo inside the hospital. Now, your nosocomial infections is acquired as a result of hospital stay. So, nakukuha mo siya during the duration that you are staying inside the hospital. So, pwede rin na hindi ka isang patient while you are visiting a relative that is inside the hospital. So, any infection that you can get inside the hospital is called nosocomial infection. Please bear that in mind. Okay? Now, you can acquire your nosocomial infections class inside nursing homes, so if you're visiting, or in healthcare facilities such as clinics and hospitals. Ayan o, so nosocomial infections are infections acquired inside the hospital. So these are the several factors that are acting together, okay, in order for you to get nosocomial infection. So meron tayong ilang factors, 1, 2, 3. So 3 factors. Okay, so the first factor, okay, additional information lang class. There is actually an increase of 36% in nosocomial infections in the last 20 years. Okay? So, imbis na mas nag-advance, in the last 20 years, mas nag-advance yung technology, di ba? When it comes to hospital equipments and how in the way of treating the diseases, diba, mas advanced na tayo in those factors. But as the technology and the advancement in hospitals increases, tumaas din, no, yung percentage ng mga nosocomial infections occurring inside the hospitals and other healthcare facilities. So ano kaya ang rason? Okay? So your nosocomial infections is actually the this is the fourth leading cause of death in US. So sa US lang ito. So wala tayong data na mahanap dito sa Pilipinas about nosocomial infections that is reliable, no, but based sa US, ito siya, nosocomial infections is number 4 in the leading cause of death. So siya yung pang-apat. Ano yung nauna? We have heart diseases, you have cancer and strokes, and ang pang-apat is nosocomial infections. So, di ba, nagpa-admit ka inside the hospital in order for you to be cured. Pero yun pala, you can actually get infections mismo doon sa hospital. Okay, so most of the individuals in the society does not know about nosocomial infection. Okay? So, kaya nga yung iba ayaw nilang magpa-admit. Most of the wealthy families, okay, gusto nila in their home na lang. Kasi mas safe siya most especially for elders, no? Because nosocomial infections actually infects persons with weakened immunity. Okay? So, parang opportunistic rin sila. So, ayan. Okay. So, your nosocomial infection, ang term yan galing rin sa Greek word meaning hospital. Okay? So, let's take up the first factor, microorganisms in the hospital environment. So, ito yung pinakaunang factor in order for you to get nosocomial infection. The microorganisms that are already present inside the hospitals and healthcare facilities. So, if mababa yung immune system mo, and then pumasok ka, na-admit ka sa isang healthcare facility that that actually contains a lot of microorganisms in the different parts of the hospital. So, malaki yung chance na magkakaroon ka ng nosocomial infection. Okay? So, in spite of major efforts to control nosocomial infections, large numbers of pathogens actually live inside the hospital. So, this is very expected. Expected mo na ito siya kasi nga, the hospital contains different types of patients with different types of diseases. And one of those patients will have infection. So, meron silang mga pathogenic. They are carriers of pathogenic microorganisms, and it is possible that they are passing the pathogenic microorganisms in living, no, other hosts such as humans, or pwede ring naiiwan nila sa mga non-living objects inside the hospital. So yung mga bedsheet, 'di ba, sa mga rooms inside your hospitals. Ayan. So meron na tayong present na microorganisms living inside the hospital environment, and not just in smaller populations, no, but actually they are very prominent, and marami yung population nila inside your hospital. So there are 3 types. So these are just examples of the common organisms that can be found inside your hospitals. Number 1, your Staphylococcus. Okay, so your Staphylococcus class, this is the number 1 cause of infection or nosocomial infections in the 1950s. Okay, so noong 1950s, karamihan sa mga nosocomial infections that are found inside, that are the patients that are having inside the hospitals are ang cause nila is Staphylococcus aureus. And your Staphylococcus is an example of a gram-positive bacteria. So meaning your Staphylococcus can be killed. They can be killed using antibiotics such as your penicillin. Okay, so madali lang ito silang they can be easily killed by antibiotics. But when it came to 1970s, your E. coli and your Pseudomonas aeruginosa are the top 1. Okay? So, napalitan yung Staphylococcus ng E. coli and Pseudomonas aeruginosa pagdating sa 1970s. And these two are both gram-negative microorganisms, meaning they are less affected by antibiotics. So, ito sila yung medyo dangerous, no? The nosocomial infections escalated during the 1970s because your E. coli and Pseudomonas are hard, no? They are not easily killed by antibiotics. Okay? Because they are gram-negative. Now, one reason for this factor, okay, so yung number 1 factor natin, isang reason dito is because your hospital environment is actually a major reservoir for a variety of pathogens. Okay? So, hindi lang isang host ang pwedeng maging reservoir. Diba? We've already tackled the different types of reservoirs present for pathogenic microorganisms. Now, pwede ring isang establishment. And one example of an establishment that can serve as a major reservoir or reservoir for pathogens is your hospital. Kasi nga, dito naka-admit yung mga patients ninyo with different infections. Okay? And another factor to be included is most of the microorganisms or most of the pathogenic microorganisms that can be found inside your hospitals are actually only infecting weakened patients. Okay? They do not, or the nosocomial infections class that originates from the hospital, they do not cause disease to healthy individuals. So kapag when you enter the hospital and you are sure that you're healthy, wala kang open wound, okay, that may serve as an entrance for the pathogens, lesser yung chance na may infect ka, okay, or that you will have the nosocomial infection. Because nosocomial infections only affects people with weakened defense, such as yung mga patients natin that have illness and is undergoing therapy. Okay? So, that is one factor to be remembered. Unfortunately, many of the strains found in the hospitals are resistant to antibiotics. Bakit? Because most of them are actually, they call this opportunistic microorganisms. Kasi nanggaling nga sila sa mga patients with weakened immune system. Okay, so karamihan sa kanila hindi nagagamot ng antibiotics such as your Escherichia coli and Pseudomonas aeruginosa. Okay, next. So, the second factor for causing your nosocomial infection is a compromised host. So, ito na yung mga patients with weakened immune system. Okay? They can be patients weakened by other illnesses, so may sakit, or other conditions, including a broken skin. So, when you say broken skin, pwedeng different types of wound, okay? That can serve as an entrance for pathogens, and the suppressed immune system. So, invasive procedures such as your anesthesia and surgery also increases the risk. Ano ba yung isang invasive procedure? So, dalawa kasi yan. Non-invasive procedure and invasive procedure. So, nahin natin yung non-invasive. So, when you say non-invasive procedure class, Isa siyang medical procedure that does not involve the breaking of the skin, for example. Okay? So, walang breaking of skin na nangyayari dito sa non-invasive procedure. Okay? And there is no contact with the mucosa or internal body cavities. So, any medical treatment class na nakukuha ninyo inside healthcare establishments that does not involve the entrance no to the body, whether pwede siyang injection, okay, so kahit anong medical treatment na hindi nag-involve ng um, breaking of the skin, the mucosa, or entering of different tools no inside your body. So that is a non-invasive procedure. Coming from its name, non-invasive, the procedure is not invading the inside of the body. Okay? So remember that. On the other hand, when you are having an invasive procedure, okay, so this is a medical procedure that invades the body or enters the body. So paano? Usually by, for example, cutting the skin. If you're undergoing surgery, pwede yan. Puncturing of the skin or by inserting instruments into the body. So, ayan. Pag sinabi mong surgery, that is a invasive procedure because it is opening and is tools are being entered inside the body. So, any type of surgery is invasive procedure. Now, why does the invasive procedure serves as an factor that increases nosocomial infection? Bakit niya na-increase yung possibility na magkaroon ka ng nosocomial infection? Because your invasive procedures actually serves or they provide a pathway for microorganisms in the environment to enter your body. Kasi nga, when you are having invasive procedures, may involve yung interior environment of the body. You are breaking, for example, surgery, you are breaking the first line of defense. You are opening the first line of defense, which is the skin. So, kapag nagkaroon ng breakage dito sa first line of defense mo, you are automatically susceptible to nosocomial infections. Okay? Your invasive procedures class, they also help in the transfer of microbes from one part of your body to another. So, pwedeng kapag yung infection mo nakikita lang sa paa, pwedeng kakalat siya sa buong parts ng body because of surgery. Meaning na infect yung inyong blood. 'Di ba? So, that is, kaya nga invasive procedure siya. Invasive procedures are very on the dangerous side. Kumbaga, mas ano siya, no? Mas binibigyan siya ng attention kaysa sa non-invasive procedures. Non-invasive procedures are just for example, laser treatment, okay, in the skin, 'di ba? So, ginagamit yan ng mga dermatologists natin, but they actually do the invasive procedures then for when they are using needles, okay? So, yan. So, you can actually get nosocomial infections from the syringe na ginagamit inside the hospital. So, yan ay isang type ng invasive procedure. Okay? So, ano ba yung mga examples natin ng mga invasive examples of situations in which a person can be susceptible to a nosocomial infection. Number 1, so unang-una, a patient with burn. So, okay, burns. Number 2, surgical wounds. Number 3, trauma injections. Number 4, invasive diagnostic procedures. Number 5, ventilators. Yung mga ventilators natin, class, these are used for respiratory illnesses. And then, you can also get nosocomial infection by using urinary catheters. Ano ba yung urinary catheters? Have you seen this? These are used to drain the urine from patients, okay? And ayan, so 1 2 3 4 5 6, okay? Those the six cases that I gave, class, this can all break the first line of defense. Okay, and will make a person more susceptible to diseases inside the hospital. So if sa anim na yan, a patient is undergoing the six, no, list that I gave, meaning they are susceptible to nosocomial infection. So ulitin ko ha, burns, if the patient is burned, they have surgical wounds, galing sila sa surgery, they have trauma injections, okay, they have invasive diagnostic procedures. So ito, class, diagnostic procedures, these are used to to identify what type of disease do you have. So meron din tayo mga invasive diagnostic procedures actually. And then you have ventilators and urinary catheters. So all of these can damage the first line of defense, which is the skin. And they can cause nosocomial infections if the environment or the hospital has a low defense from pathogenic microorganisms. And among the six class, the burn patients are actually the most susceptible to nosocomial infection. They are extremely susceptible to nosocomial infection. Bakit? Kasi nga, 'di ba, if our first line of defense is our skin, and if there's something wrong with the skin, then there is more entrance or entryway for the pathogens inside the hospital. So, kaya yung mga burn patients natin, nilalagay sila sa intensive care, and mas mas matindi yung they call this, mas matindi yung paglilinis or sterilization sa mga burn patients natin, and especially the environment that they are in, dapat free from microorganisms to prevent infection of the burn. Okay, now let's go to the third factor, which is the chain of transmission inside the hospital. Okay, so we have 4 chains of transmission happening inside the hospital. Number 1, we have direct contact transmission from the hospital staff to patient. So, yung hospital staff natin, class, pwedeng from doctors to nurses and to the ones that are cleaning the hospital. So, your hospital personnel can actually, they are the number one, they can be the number one transmitters, no, of diseases. Bakit? Kasi nga, sila yung in contact, or they are in a direct contact with your patients every day, the whole day. Yung mga doctors natin. So, iba't ibang patients ang nakakaharap nila araw-araw, and iba't ibang infections and diseases rin yung nakakaharap nila araw-araw, and also your nurses. That's why hospital staff, okay, must be the number one role model in cleanliness and sterilization, because they can be the number one transmitter of diseases if they fail to follow the sterilization protocols. Okay. Number 2, or letter B, we have transmission from patient to patient. So, when the hospital class is very crowded, the the possibility of nosocomial infection increases. Kapag mas crowded ang isang hospital, mas mataas din yung transmission of nosocomial infection, kasi dikit-dikit na yung patients. Okay, so ito yung nangyayari mostly ngayon, no, we are having a pandemic. So, mataas rin yung level ng nosocomial infection inside the hospital, especially if it is very crowded. So, letter C, we have using fomites. So, if the hospital that you are in, admitted into is not clean, they don't have proper protocols for sterilization, then mataas rin yung possibility that you will get infection from fomites. So, saan, 'di ba, natakil na natin ang fomites? These are non-living objects that might transfer infections or diseases because of the presence of pathogenic microorganisms that are found on the surface of fomites. So, one example natin ito, the bed sheets, the pillows, the surgical masks, surgical gloves. So, ayan. Though all of those can be fomites if they are not, hindi sila natapon in a right way. So, dapat yan sa mga surgical mask, surgical gloves, and syringe, sinusunog, no? So, especially if virus yung kinakaharap ng patients. Okay, letter D, we have ventilation system. Now, transmission of nosocomial infections also varies depending on the quality of the ventilation system of a healthcare establishment. Okay? So, nagde-depend din sa ventilation system. Especially if the disease or the infection is airborne. Now, if airborne, yung virus or bacteria, 'di ba? If the ventilation system is not good inside the hospital, then most probably nosocomial infections will occur. Okay? Next. So, in here we have the list of most vulnerable patients for nosocomial infection. Number 1, we have the newborn and the premature babies. So, yung mga bagong pinanganak. Number 2, women in labor and during delivery. When you are under labor and delivery class, so, nagkakaroon din ng open wound, okay, yung ating mother. So, prone siya to nosocomial infection. Number 3, surgical and burn patients. Number 4, diabetic and cancer patients. So, why diabetic and cancer patients? Because they are undergoing therapy. And individuals undergoing therapy are very susceptible to nosocomial infections. Number 5, those receiving treatment with steroids, anti-cancer drugs, anti-lymphocyte serum, and radiation. Number 6, those with deficient immune response. So, ito yung pinaka-number 1, no? And then, we have patients who are paralyzed or who are undergoing renal dialysis and catheterization. Okay? So, kasi dito sa renal dialysis natin and sa catheterization, you are inserting medical tools inside the body. So, another factor for nosocomial infection. So, these are the individuals that are prone to nosocomial infections. So, during the years, 'di ba, we are very thankful for Lister and, do you remember Lister and Semmelweis or Semmelweis, because they are the ones that developed the aseptic techniques. So, until this day, we are still practicing aseptic techniques. Okay? But so, kasi yung aseptic techniques natin, class, they actually decrease the rate of nosocomial infections considerably. Simula nung gumamit na ng aseptic techniques inside the hospitals, so bumaba yung nosocomial infections natin. So, ano na lang talaga, no, the nosocomial infections will depend on the capability of the hospital to handle this type of infections, or to handle or to control the spread of microorganisms inside the establishment. So, nagdedepende ang nosocomial infections sa galing ng hospital and ng mga hospital staff in controlling nosocomial infections. Okay? So, let's continue. Now, you have here the control of nosocomial infections. How will you control, or how will healthcare facilities, they call this, how will your healthcare facilities handle the spread of nosocomial infection? Okay? So again, your nosocomial infections will vary from one institution to another depending on their capability of controlling. Okay? But it is certain that certain health facilities will really have procedures, okay, for nosocomial infections. So, meron talaga silang, each healthcare facility may fina-follow na procedures that are generally implemented in their establishment, okay? Or in the facility. So you have here, hospitals are required to have an infection control committee, an infection control nurse, and an epidemiologist. So, ano ba yung ginagawa nila? Their job is to identify the problem source or the problem sources, check the equipments for contamination, and check sterilization procedure. So, mas ano natin siya. Please take note. Okay, these are the roles of your infection control committee, nurse, and epidemiologist. Number one, they identify problem sources. Ano yung mga problem sources nila? Such as your antibiotic resistant strains of bacteria that are present inside the hospital. So, they will check if merong presence ng mga antibiotic resistant strains. And then, they will also check improper sterilization techniques. So, baka mamaya, the other staff of the hospital is not implementing proper sterilization techniques. So, they check that every month or every so often. Number two, we have, so your infection control committee nurse and epidemiologist class, they must make periodic examinations of the hospital equipment. So, dapat chine-check nila every now and then yung mga hospital equipment natin to determine if they have contamination or microbial contamination, and to determine the extent. If meron ngang microbial contamination, ano yung extent ng microbial contamination. So, that is another job for the infection committee. So, how do they do this? They get samples from your equipments. So, tinitest nila yung mga hospital equipments for contamination by getting samples from your tubings, yung catheters, the respirator reservoir, and other types of hospital equipments. Okay, so sila ang nag-check. Now, when it comes to the epidemiologist, ano ba yung epidemiologist natin? Okay, when you say epidemiology, it is the science that studies when and where diseases occur and how they are transmitted in population. So, yan yung main goal or main study ng isang epidemiologist. Okay, he is trying to know kung anong pinagsimulan nung kailan nagsimula yung nosocomial infection or yung disease, saan ang galing, okay, and paano na-transmit. Okay, epidemiology studies when and where diseases occur and how they are transmitted in populations. Okay, so kaya it is very important that inside a healthcare facility, merong present na epidemiologist. Okay, next. So I have here the means of controlling your infection. Okay, number one, so ito yung pinakauna, you educate the staff. Okay, education of the staff. So this includes all the hospital staff from doctors to the cleaners or the ones that are doing the sterilization. Number 2, hand washing and gloves, wearing gloves, very important. Number 3, aseptic techniques where appropriate. So, dapat tama yung ginagamit ninyo na aseptic techniques. Proper use of chemicals, okay, for aseptic techniques. Careful handling of contaminated materials. So, dapat the hospital staff are able to identify which materials are to be thrown away or to be burned depending on the contamination level. And then number 5, isolation where appropriate. So, dapat naka-isolate ang mga patients that have extreme infections or the ones that can contaminate other patients. So, siguro dito sa limang ito, the most important is the education of the staff. Because sabi nga kanina, the control of nosocomial infection will always vary on the capability of the institution or the hospital you are in. So if the hospital or the healthcare facility is not competitive enough, okay, in these types of situations, then walang you can assume that the staff is not properly educated, so the staff will also not have the proper knowledge in controlling nosocomial infections. Okay? So, when it comes to hand washing, diba, you can always watch the television and always merong ad na about hand washing. Why? According to your Center for Disease Control and Prevention, or also known as CDC. Again, Center for Disease Control and Prevention, or CDC, hand washing is the single most important, okay, way of preventing the spread of infection. So, sapat na, no? Hand washing lang, sapat na. So, hindi naman siguro hand washing lang sapat na, but it plays a very big factor in preventing the spread of nosocomial infection, especially inside the hospital. So, kahit in your everyday life, always remember to always wash your hand to prevent any infection from occurring. Okay? Especially that we are in a pandemic. So, I guess that's it. Okay, that's the end for chapter 8 about nosocomial infections. Again, this is a very short lesson. And I hope na marami kayong natutunan on this part because this is very important for nursing students. Baka in the future magiging infection control nurse kayo. So, and I guess you are properly educated about this in your other nursing nursing courses. Okay, so that's for chapter 8. See you on my next video for the last chapter in our finals, chapter 9. So, sa sunod na video, chapter 9 na tayo. Maybe I will divide that into 2 parts or depending on the time, no? So, thank you class for watching. I hope you've taken down notes and see you again on my next video. Bye!